one of the things that we'll be doing in this channel is interacting more with our audience. And we're going to be doing that by answering all the questions that you have on YouTube or on our social media pages like Instagram and Facebook. And in today's video, we have a post of dental implants that you pulled out. And the question that this person had, they're wondering the difference between poor quality and good quality implants. What can you tell us about that?
Okay, so yeah, so this post basically, this was a patient who came in. Obviously, she had had quite a few implants placed, and there was so much bone loss around the implants that we had to remove them. Because what we don't want to do is, let's say that I did have decent bone around them, I could have used these implants, but there was so much bone loss that had I built this brand new beautiful set of teeth on these cheap or less expensive, cheap implants that already had bone loss, I'm building on a foundation that's not good. So I want to build on a very solid, strong foundation that I can count on, because again, it's all about the patient's long-term success and investment. And so this is a great question, and we'll get these questions quite often on our social media or on YouTube. What is a quality implant and what is a implant that maybe not so great a quality? And so if we look at these, maybe do like a close-up shot of these implants. So notice here, first of all, when we're looking and dealing with implants, first thing we want to know is, okay, so what is the material? What type of metal is it, right? Because we're putting metal screws in the patient's mouth. And these are most definitely a titanium alloy implant. So the material itself is an alloy, and alloy is a mixture of metals, right? In our practice here, we only use commercially pure grade 4 titanium implants. I don't like to use alloys because we don't really know how the patient's going to respond. We know that titanium, 99.9% of patients react super good to titanium. Their body accepts it. The bone integrates with the titanium. The tissues accept it. And so we want to eliminate any factors that could potentially cause problems. And so that's the first step. And when we're talking about credentialing, this kind of goes back to that question. When we look at these two implants, and first of all, they're two different brands of implant, two different connections. So the internal aspect, this aspect here and that aspect here, are completely different. So this actually tells a story to me anyway, as having had removed them. I mean, certainly, there was not a lot of planning involved. I would never place like one brand of implant and then place another brand right next to it. I'd use the same and maintain the continuity throughout the entire case. So that's one thing. You can just kind of see like the external aspect. The finish is not great. The internal aspect also, I can see that there's just not good quality finish. And then the main thing is the material of these implants. Now let's take a look at a implant that is high quality. And I don't know if you can see the difference here, but there is just the external aspect of this implant, the titanium. One thing, and I say this quite often on my videos, is there was a time where I worked in an office where they used one of these cheaper quality implants. And every time I opened up the package, the color of the implant was different. And so that kind of threw me off a little bit, because I'm like, if these implants are commercially pure titanium implants, it'd be the same color every time. They were not. They were titanium alloy. Whereas every time I open up a Noble Active or a Ti Ultra implant, the color of the titanium is exactly the same every single time. So that tells me as the surgeon that I can count on this. There's continuity here. And so just the fit, the finish, because we have to look at the implants from a surgical standpoint. How is it going to integrate into the bone? And then from a prosthetic standpoint, how do the parts and pieces fit into the implant? And so there's thousands of different implants on the market. all different types of connections and titanium alloys. And so, it begs to question, back to our discussion of credentialing. It boils down to the ethics of the doctor. I make this decision. When I place this implant in the patient's mouth, that's a decision that I make, and I have to, basically stand by whatever decision that I made. So at the end of the day, I will only use the very finest quality, because that's the foundation that I'm laying. And so I want to have we demand success with that.
Yeah, and we've seen success. Like you are using the highest quality of implants, and you've been placing those for the last 10, 15 years, and you've seen that they've lasted
exactly.
This long. But my question is, why do oral surgeons or these doctors use the cheap or the not so good of quality of implants?
You've got, most oral surgeons are going to use most oral surgeons would never use a knockoff brand implant. So because you've got the high quality companies that have done the research, are writing all the white papers, and then you'll have a company come along and knock off a part of the implant, whether it's the internal aspect or the external aspect. Knock off meaning they copy it, right? And so they'll copy these implants, and then they'll use a cheaper material, and then doctors will buy those at a fraction of the cost. This implant cost me 5 times of what this implant cost this doctor here. I can guarantee you this implant was probably less than $100 per implant. And then, these are well over $500 an implant. So so that is really what dictates for a doctor, what system they're going to use. And it's all, the cost. And so, and so for me, the cost is, of course, I have to watch my overhead and my bottom line, but I'm not going to sacrifice the long-term success of my cases for a cheap, inexpensive knockoff implant.
Yeah, no, I get it. So pretty much what doctors who are placing cheaper implants are doing is they're getting it for a fraction of the cost, so then they can do the procedure for way less than what we do or anyone else with good material does, but it just doesn't last long.
Yeah, but sometimes they can get away with it, but it just takes 1 or 2 cases that have completely fallen apart, But I don't want to sit here and say that even the titanium alloy implants, a lot of times they integrate just fine, but when they don't, it's a big issue. It's a big problem for the patient, because the patient has spent all this time and money, and now all of a sudden it didn't work out for them. So. So for me, I want to try to eliminate any factors that would cause long-term failure or long-term problems for the patient.
So speaking of that, how long would a high-quality implant like this last compared to a low-quality implant?
Yeah, so, longevity is based on a few things. One is patient care. They have to maintain it. They have spent money on fixing their teeth, so they've got to brush, floss, irrigate, and maintain the prosthesis. So that always plays into the success of cases. But then discussing materials, the quality of materials also affects the success of cases as well. So a cheaper implant, you're going to see bone loss first, because if you lose an implant, it's because the bone is starting to pull away from it. The body doesn't like it being there, so the tissue pulls away, the bone pulls away, and so that's when we start seeing major bone loss, and then we're starting to have to remove those implants. How long? I've seen cases, that we've seen come in from other offices that are using some of these cheaper implants, come in after about 1.5 years, where we're having to remove these implants because of bone loss and failing prosthetics. I've spoken quite a bit about that, because you've got 2 things when a case doesn't work: is the prosthesis doesn't work or breaks down, or the implants have issues with the implants. So there's two different ways that they would have those problems. But so again, nobody's perfect, but at the end of the day, if you try to use the best materials possible, take every step to ensure success, and that's where like having teeth in 24 hours a lot of times is it's just not, it's not the right way to go, and it's certainly not the right way to go for every single patient. And so you know, here at Trust Implants, we take, you know, I just go by the book on every single thing, and I don't cut corners, so that in the end, the case's long-term success is my #1 goal.
Awesome. I also want to point out the fact that you know all of this, not only because you've been doing it for so long, but in that time, probably what, 30 to 40% of the cases that you do are people who already got implants somewhere else,
Yeah.
right? And you have to kind of do the cleanup. You have to
cleanup,
pull out and do all that, right?
Yeah, I mean, that's facts. You know, I would say about 30% of the cases have come, you know, they've had implants. They've already spent their money, you know, they've spent the money on having it done, and now they're doing it again. And so, and this is another reason why I'm so passionate about this, because I hate the look on their faces when they're like, you know, having to do this all over again. But by then they've done their homework. They've done their research. Maybe the first time around they didn't, and so they're having to kind of pay for that. So for patients who have not been through the process, you know, that's one of our goals with this channel, is to ensure that a patient or a person who needs this procedure can collect as much information as they can, so that when they do make the final decision, that they have as, you know, they can do it with knowledge, and they can do it with confidence.
Awesome. Well, thank you very much, Dr. Willardsen, and thanks for answering the question of this person on social media. And that is it for today's video. Like you saw, we'll be answering all of your questions. Make sure that if you like the video, you hit the like button, you subscribe to our channel, and again, leave as many comments as you have. We'll be happy to answer all those for you. Thanks for watching Trust TV.